Hi everyone, welcome to a continuous series on family planning. As we have checked previously, we tackled on the mini pill. So today we are going to tackle on the pill, that is the combined oral contraceptive. Just as the name suggests, it means that it's a pill that is going to use to prevent pregnancy. And also from the word combined, it is a combination of two hormones, that is the progesterone and the estrogen. And the word oral, it means that the pill is taken orally. So we have several types of the combined oral contraceptives, or we can call them the COCs. We have the monophasic, we have the biphasic, and the triphasic. Monophasic means that the whole packet of the pills, it contains 21 tablets, hormonal 21 tablets, and 7 non-hormonal tablets. So in the 21 pill, it means that all the 21 pills, they have one hormone or one dose of the hormone. When we go to the second one, the biphasic, it means that it contains two varying hormones in the 21 hormonal pills. It means that the dosage in, like for example, the first 11 tablets, it is different from the next 10 tablets. Then the third one is the triphasic. The triphasic, it means that it has three different hormones in the 21 pills. Maybe the first 10 tablets, they have a certain range of hormones. The next 10 pills, they have different dosage of hormones, and the next 11 pills, they have different dosage of hormones. Now that's why we say that we have three types of COCs, that is the monophasic, the biphasic, and the triphasic. The effectiveness of these oral pills, the combined oral contraceptive, depends with the user, depends with the one who is taking the pills. In that, if you take the pills at the correct time, the same time every day, and you start a pill when it is required, the pack when it is required, it means that the hormone, they are going to be consistent in your body, and it's going to be effective to prevent pregnancy. So in a case of someone can have diarrhea or vomiting after taking the tablet, one can also forget to take the pills. So those are the things which minimize the effectiveness of this oral contraceptive pill, and this makes it to be between 93 and 99%. So it is not 100% effective when using it. The mode of action, how it works, the combined oral contraceptives works in three ways. We said that it has two hormones, that's the progesterone and estrogen, which are almost the same as the hormones which are found in the female body. So they are going to thicken the cervical mucus. The cervical pathway, or the cervix, is where the sperms get to penetrate to the female genital tract. So because of the progesterone, it's going to thicken the mucus, and they're going to prevent the sperms from penetrating to effect fertilization. It also contributes to prevention of pregnancy by thinning the endometrial wall. So it makes the wall to be so thin that no fertilized ovum that can attach into it. And by doing so, it prevents pregnancy. And in that way, how it prevents pregnancy is that it prevents ovulation from occurring. So it prevents maturation of the ovums. So no ovums are going to be released for fertilization. So in these three ways, it prevents pregnancy in a fertile female. It has several ranges of side effects. It can make one to have a headache. It can make one to have mood swings. One can experience a slightly change in blood pressure. The pressure can go high, but with time, the pressure, when you stop the pills, the pressure comes down. It will also make one to have dizziness. So I would advise, if you feel that you have been a dizziness, it's good always to go down on your knees, or you sit down to avoid a falling. which can worsen the condition. It makes one to have nausea and vomiting. So to prevent the nausea, it's advisable to take the drugs with meals, or you take during the bedtime when you are planning to go to the bed. So that is a recommended time for you to take these pills. By doing so, you won't experience the nausea thing. It also can make one to have excessive hair growth in the face and also in the chest due to changes in the hormones, and can also interfere with the normal cycle flow. So it can interfere with how the menstrual cycle flows. It has several benefits. When you take the oral combined contraceptives, first is going to prevent the unwanted pregnancies. It can help someone who has already given birth to space their babies from one baby to the next baby, so their babies can be healthy and the mothers can recover from the pregnancy state. It will also help a mother to prevent anemia, because you're not going to be losing a lot of blood, or some people they even miss the menses, so you won't experience a lot of losing blood, so it can prevent anemia to the mother. It also prevents the occurrence of some diseases like the pelvic inflammatory disease, because the operculum of the mucus prevents the penetration of some organisms into the upper tract system of the female. It also prevents the cancer of the lining of the uterus and also the ovaries. So it is very beneficial to the mothers, and it is very important for one to consider using it. Although it is not advisable for mothers who have babies less than 6 months. So it should be used when the baby is above 6 months of age, after the baby has already started to take other feeds, because it is known to diminish the milk production. How to use this pill is very easy, and I would urge to listen carefully to the provider's instructions, and it will be very effective or very beneficial and easy to use the tablet. So in this case, we have a pack of, some have 21 pills, others have 28 pills. So in the 21 pills, you'll find that all the 21 pills are hormonal pills, and 7 are non-hormonal pills, which are used to supplement blood in the female body. The oral combined contraceptive has, some packets have 21 tablets, which means all the 21 tablets are hormonal tablets. And others have 28 tablets, which means that 21 tablets consist of the two hormones, that is the progesterone and the estrogen in combination, and 7 tablets contains hematinics, that those are tablets which can supplement blood in the human body. So how to use this pack, in that the pack at behind has arrows from day 1 to day 21. So it has arrows which follow each other. So this tablet should be started from the point of day 1 where the arrow is. Then you just follow the arrows, the rows until you finish. So some clients may decide to take only the 21 pills and rest for 7 days, then start another pack after the 28 days. Other clients might decide to take the continuously for 12 weeks, then they rest for 1 week and they start again for 12 weeks. Others may decide to take continuously without stopping any day. So they just take the pill every day. So we have 3 ways of taking the combined oral contraceptive pill. So ideally, one should start from where the first day is, then you follow the arrow until when it is over, you start another pack. So for those who are supposed to rest, they'll rest, then start another pack. In case a client experiences a cases of vomiting or vomiting within 3 hours of taking the pill or missing a pill, one should retake the pill. In case of missing a pill, one should use emergency combined contraceptive to supplement the lost days. The difference in the hormonal balances in the body. The pills will work effectively if they are started the first day of the menses. That is when a lady is going to start their menstrual period, that is their day 1 of the cycle, and that's the best day to start the pills. In case the pill is started in any other day of the week after or any other day in the cycle, one should use a backup method. That is, you can use the CDs or you can use the emergency contraceptive pills to prevent one getting pregnant. In a case where a client misses one pill, one should take another pill immediately after they have remembered and continue with the normal cycle. In case of missing 2 consecutive pills in a row, one should take a pill immediately after they have remembered and continue with the normal schedule of taking the pills. In case a client forgets to take 1 or 2 pills in a row, one should take another pill immediately after they have remembered, and they use other measures to prevent pregnancy. For example, you can use emergency contraceptive pills to prevent getting pregnant. If a pill is missed between day 1 to day 7 of the cycle, one should use a backup method. And if a pill is missed between day 8 and day 14 of the cycle, and in the previous 7 days one had taken the pill's faithfulness, one should not worry about being pregnant and they should not use a backup method. In case a pill is missed from day 15 to day 21, one should start the next pack immediately after finishing the current pack to ensure that there is hormonal balance, hence preventing pregnancy. So each and every method has their own advantages and disadvantages. So we are going to check the advantages and disadvantages concerned with combined oral contraceptive. As you start with the advantages, one of the advantages is that it's going to prevent unwanted pregnancy and it's going to promote healthy living of the mother and also spacing of the newborns. It also prevents the occurrence of anemia, that is low blood levels in the body, because it's going to prevent bleeding during the menstrual cycle, and it is simple to revert, in that if today you realize that you have some side effects concerning the pill, you can just decide to stop and it reverts immediately, not like the long-term methods one uses. It is easy to administer because they are just pills. One can take them from their home and one can also access them over the counter in case they have a stock out. You don't require a health professional to administer the pills to the client. So when the supply is over, one can just go and buy them and continue using them without any prescription. It prevents the occurrence of pelvic inflammatory disease, as we discussed earlier, that there is thinning of the endocervical mucus, which prevents penetration of microorganisms to the upper female genital tract. And also it prevents the occurrence of ectopic pregnancies because it does not allow fertilization to take place where it is not required. Some of the disadvantages related to combined oral contraceptive is that one has to take the pills daily. So in case one forgets, it's a problem that they had high risk of conceiving. So the pills have to be taken every day. The other disadvantages with the oral combined contraceptive is that it does not protect the client against sexually transmitted diseases. So one is at risk of contracting the sexually transmitted diseases. It increases the chances of a client of getting vascular diseases like the deep venous thrombosis, like the hypertension. They can be contributed to by the combined oral contraceptive, and it's also not recommended for all clients who are above 35 years and all clients who smoke cigarette. They cannot take this pill.